Welcome to EyeCan, a podcast about ophthalmology through a uniquely Canadian lens with Dr. Serare Ziai and myself, Dr. Guillermo Rocha. We'll share our experiences as ophthalmologists today and tackle some challenges we face as healthcare providers. Are you ready, Serare?
Let's do it, Guillermo.
On this episode of EyeCan, we talk with COS President Dr. Colin Mann and CEO and Executive Director of the COS, Elisabeth Fowler, about what's in store for the COS in 2021. Nova Scotia native, Dr. Colin Mann is a comprehensive ophthalmologist based out of Bridgewater, Nova Scotia, about an hour south of Halifax along the picturesque South Shore. He has been a part of the COS since 2001 as part of the Maintenance of Certification Committee and an active member on the COS Board of Directors since 2012. He is currently in year one of his 2-year term as president of the COS.
We're also joined by CEO and Executive Director of the COS, Elisabeth Fowler. Elisabeth, or Liz as we call her, started with the COS in October 2019. She comes from a diverse and robust background of business and marketing, spending her entire career in the healthcare sector with significant experience in advocacy and engagement in health policy. Welcome to you both. Thanks for joining us today.
Thanks, Serare. It's great to be here.
Thanks, Serare.
So just before we get started on all these amazing questions Guillermo and I have for you guys, do you want to explain to our listeners, I know because I'm on the board and Guillermo's been on the board, but some of our listeners may be a little bit less aware. What is the exact role of the Canadian Ophthalmological Society? What are we there for? Who are we there for?
Great question, Serare. I think at the end of the day, we are a group of ophthalmologists. We represent, I think currently our membership is probably about 70% or so of the ophthalmologists in Canada, something like between 900 and 1,000 ophthalmologists. Our mission really is all around improving patient care. And I guess if we really want to look at it, that's sort of a three-pronged mission, which is summarized in our mission statement. But basically, the mission is to strive toward the provision of optimal medical and surgical care for all Canadians by promoting excellence in ophthalmology and providing services to support our members in practice. COS is also an advocate for vision health for all Canadians and advances vision health by improving Canadian eye care standards through the work of the Board of Directors, the councils, the committees, as well as ties with other national and international ophthalmological and eye care organizations and partner organizations. So I think it's probably those three prongs, but at the end of the day, we're here to support our membership. And at the end of the day, the aim of all of that is to advance and improve and support excellence in ophthalmology care in Canada.
It's been such an unprecedented year for everybody. I'm sure that the events that we've all experienced in the past year were nowhere near your radar when both of you stepped into your new roles at the COS. I think it's fair to say that it's been shocking to all of us. What were the biggest challenges that either of you faced personally within the last year in your new roles within the COS?
Certainly, the way the elections go for the COS, I have a role as president-elect for a year before I jump into the president. So I did sort of see this coming a little bit. The year as president-elect is meant to be an opportunity to sort of get acclimatized to the role and get up to speed with the board issues and how things work. I've been on the board for 6 years, so perhaps that wasn't as important. But given the pandemic and the emergence of the pandemic for really 4 or 5 months before I stepped into the role, it was a great opportunity to join in with Liz and Dr. Yvonne our past president now, and hit the ground running. I think probably one of the major challenges or the changes that I found from my previous experience with the board and seeing how things worked was not just in my role as president, but really in our professional and practice lives as well. pre-COVID, it would have been unusual for the rules or the protocols or the things that we tend to guide us in our practice to change in a monthly or weekly or even daily basis. But this has really become the norm and became the norm around the time that I was taking on the role. It has applied to both my practice life, but I think also my role as president. I think in some ways it's quite unsettling for all of us. Both Cedere and Guillermo, you know from my time on the board with you that I love my analogies. And the analogy I make being an East Coaster is that it's the feeling like when you're on the beach and the water washes in and the sand under your feet is shifting around as the water goes back out. And I think that's the feeling we've probably all had in our professional lives, but also I've found in the role as president. Because of that, and because of that changing situation, I think it's demanded a much more compressed timeline for new initiatives, for responses to what's happening around us, and for everyone involved to be much more agile and moving quickly.
You talked of a very safe shifting waters on the beach and in the sand. You're an avid sailor. And you deal with rescue and other things. I mean, this sounds to me like a year where your analogy should have been maybe along the sailboat thing and trimming the sails and making sudden decisions. What do you think?
Yeah, it's probably an apt analogy as well. I think you could extend it in a bunch of different directions. You guys probably know about Peggy's Cove, which is one of the icons of Nova Scotia. And, people from away sometimes stand a little too close to the water and there's a wave that comes in that's sort of unexpected and washes over them and sweeps them off the rocks and can result in tragedy. I think we've all felt a little bit like that as well. The sailing analogy is apt. They say we can't change the wind, but we can adjust our sails, and all sailors and East Coasters know about that. And I think there's been an awful lot of that going on as well during this time. I think probably one of the major challenges for everyone has been in staying healthy and keeping mentally healthy. And you guys talked about it in your first podcast, I think. And I think, that was really useful. The physician health, physician wellness issues have been somewhat front and center prior to the pandemic, but I think the pandemic has magnified those as well as a lot of other things. And, I'm really proud of the way in which COS has developed a sort of multi-pronged approach to education around physician wellness issues this year. And I think that was one of the challenges we faced and probably continue to face in the society and the members of the society as we move forward.
I think it's a big year for wellness everywhere, not just in medicine, but, it's a major topic of discussion because everyone's life has shifted so much in the past year. What about you, Liz? What were the biggest challenges that you faced you were relatively new at the COS as well when everything started changing, weren't you?
I was, yeah. I started at the COS in October 2019, as you mentioned in your intro, and so I had just been with the organization for about 5 months before the pandemic hit. And in addition to that, the team were only 10, but it was quite young and new as well. There are half of us who were new as I am, or even newer. We have some people who joined during the pandemic. And so when it hit, talk about adjusting your sails, the entire team had to move to working from home. And a number of the group have never sat in the same room as their colleagues. So it has been a bit of a challenge to try to make sure that the team feels connected to each other and to the work of the COS. And so not only did the team had to shift the way in which they were working, but also on what they were working, because our focus obviously had to change from the initiatives and projects that we were working on towards more supporting our members through the pandemic and trying to, create guidelines and try to create a sense of community. And then, of course, our annual meeting, which is in June every year, and one of the biggest things that we do, had to be canceled and shifted to a virtual setting. So that was quite a challenge. And I have to say the team was pretty amazing in how they turned that around so quickly.
I remember spending quite a bit of time doing strategic planning while I was on the board of the COS, but obviously that has changed. So what do you both see as some of the hottest topics or some of the best themes in terms of moving forward with the COS as the hottest topics really in the next few years?
That's a great question, Guillermo. I think, it's one that we're constantly thinking about. And I know we had lots of discussions around the time that you were involved with the Path to New Vision webinar. I think one of the things that we've been talking about and will continue to talk about as a hot topic will be, sort of the aspects of practice that have changed during the pandemic. We've all been forced to critically examine aspects of our practice to minimize contact and risk from contact. A lot of the innovations in practice and technology that we've developed and have been developed during this time because of necessity will probably stand the test of time. And I think will continue to drive excellence in patient care long after the pandemic finishes. I hope we can explore and share some of those in 2021. The question will be, what did we change because we had to and was sort of a stopgap and we'll go back to the way we were doing things, and what actually improved our care and perhaps made care more accessible to patients and improved the efficiency of what we do. I think just as there was a need for sharing of information and dissemination of guidance for best practices during the emergence of the pandemic, I think there'll be a similar need as we move out of the pandemic. How do we make the transition back to what practice will look like beyond the pandemic? How do we start to deal with a backlog, or as I heard it referred to the other day, as a debt of patient care? I think there's going to be a lot of challenges around that, and it's going to be important that we have conversations that lead to guidance around best practices there. Beyond that, I think also there's some new therapeutics and technologies. Research into those hasn't stopped because of the pandemic, but the clinical trials and patient experiences that inform those innovations have undoubtedly been more challenging. And I hope as we move into 2021 and maybe early 2022, we'll see Canadian ophthalmologists being able to think a little bit less about just how to deliver care, but also continue what they've always done, which is delivering care with efficacious and cost-effective therapeutics and technologies. And so I think we'll see the emergence of a number of new therapeutic options and diagnostic and therapeutic technologies that have perhaps been slightly delayed by the pandemic. One example would be in the area of gene therapy for inherited retinal disease that I think has been touched on maybe during this podcast series, but we'll be hearing more about that. Recently, the Canadian Glaucoma Society put out a guidance paper on teleglaucoma, and our Dr. Hadi Sadhab, our chair of Council on CPD, was involved in that, and that was endorsed by the COS, and it has various models of care that I think will probably be applicable long after the pandemic has finished. And finally, I'm sure we'll talk a little further about it, but the planning for the annual meeting in 2021, which is going to have, I think, an amazing array of topics. One of the things that perhaps is exciting is that our team of section chairs who plan the meeting have done so without worrying about the burden of travel and the associated time commitment for speakers. And so I think they've been able to put together a dream team of invited speakers. So I think those are some of the things that are going to be exciting about 2021 and some of the sort of hot topics.
So thank you for that, Colin. Now, on your own practice, at a personal level, what do you think has been the best change that happened during the pandemic? The one thing maybe in your own practice that you're most proud of, and what is the thing that you miss the most?
Yeah, it's a great question. It's something that we reflect on a lot. I think, the question is really getting to, again, what you guys talked about in the first podcast, which is, a bit about what the essence of patient care is for you and what you enjoy about it. I think one of the unintended consequences, and no one would ever wish a pandemic for it, to bring this on, but it has forced me to slow down. I see less patients in a day. I'm able to engage perhaps a little deeper with them. I think the pandemic and the worries around the pandemic have led to conversations with patients that I might not have had otherwise. And I don't know whether I have one innovation that I've done or changed, but I think really what I'm happiest about is it forces you to look at everything you do in your practice. Why do you do it? Is it efficient? Is it best for patient care? And sometimes we just get stuck a little bit. I've been in practice for 30 years last month, or this month actually, a full-time practice. And sometimes we do things because that's the way we've always done it. And I think probably if we could find silver linings in what has been a very, very dark cloud, it's been that it's forced me to look at everything I do in my practice and why I do it, and provide some rationale for why maybe it shouldn't be done a little differently. And in many cases, I'm changing some of those practices and getting kicked out of my rut.
Yeah, great points. Thank you.
Liz, how about you? What are some of the exciting projects and initiatives through the COS that you're looking forward to for the coming year?
Thanks, Sidere. Colin's already mentioned the annual meeting, and I just wanted to highlight that again. It will be a virtual meeting again in 2021, but it's going to be fantastic. In addition to the speakers, we've really focused on trying to help create a sense of community amongst our members, and so there's going to be lots of opportunities to get together and talk with each other. We've enhanced it given the feedback that we had from our members and our partners and supporters, and so we're really excited about that. We're going to be doing a lot of advocacy and outreach related to creation of a vision health desk at Health Canada. We've got a robust advocacy plan thanks to our great communications team. And so we're going to be working really hard to promote the value of ophthalmology to all of our stakeholders, to policymakers, governments, and Canadians. And speaking of just the patient and the Canadians, we also have an enhanced See the Possibilities website. And this site has got a lot more functionality, interaction, some games and things that make it that will really draw the patients in. And we're working on a series of animated videos that will sort of describe in very easily, a quick and easy description of the big four eye diseases, which we hope will be helpful for patients to help them understand more about it and to help prevent vision loss, to get the information that they need to know, the early warning signs. And we hope that our members will find that useful when they speak to their patients as well. We've also got some wellness workshops. I believe it's been mentioned on this podcast and by Colin as well, how the importance for people to consider their health and mental wellness as we get through year 2 of a pandemic. And so we've got some initiatives related to that coming through. And then finally, also following up on our strategic plan, Guillermo mentioned that he'd done a lot of work and the plan is quite robust. And so we are continuing to work on that through 2021.
And if people want more information or they want to see the Possibilities campaign and hear more about the wellness initiatives, they can do all of that by accessing the COS website, the new COS website, right?
Yes, they can go to cos-sco.ca, and that will give you all the information about the initiatives that the COS is doing, and also provides a link to the See the Possibilities website.
EyeCan wants to know what you think. Please send your comments on today's episode or any suggestions you may have for topics or features to communications@cos-sco.ca, and we'll try to incorporate them into future episodes.
Hi, my name is Dr. Nita Ahuja. I'm an ophthalmologist and author of Stress in Medicine, Lessons Learned Through My Years as a Surgeon from Med School to Residency and Beyond. I listen to the EyeCan podcast and think it is a wonderful resource. I'm so happy that this is available to us, and I hope you enjoy listening as well.
Yeah, Liz, I'd like to follow up on a little bit about what you mentioned about the stakeholders. We often talk, obviously, about our own membership. We talk about the patients. We have great relationships with industry as well. And so what is the feedback that you're getting in terms of what's happening with industry, the relationship with ophthalmology, with the new virtual meeting? Fact that many of the reps from the different companies are not able to visit as many of the ophthalmologists as they could before. What is your feeling? What's the pulse that you're measuring there with industry? How can we keep them engaged?
Thanks, Guillermo. It's a great question, and it's one that we think and talk a lot about internally as well. And our partners and our supporters, I mean, they're feeling the effects of the pandemic a lot as well, and so we've had to be aware of that. And for them, what we're hearing is their biggest needs really are a place where they can engage with our members. They as you've mentioned, they can no longer visit physicians in hospital or in their clinics due to the pandemic. And so they're really looking for ways that they can continue to maintain those relationships and to deliver the information about the new devices and innovative medicines that they've created. And so our annual meeting is one way that we're working to make sure that they have those spaces to help engage one-on-one and with groups of physicians. And then we're also working with them on some continuing professional development, co-developed programs to help in that way as well.
What have you seen as some of the challenges and also some of the positive alliances or strategic planning that has come up with working in terms of patient care when it comes to dealing with optometry and opticianry as our kind of members of the eye care team? We've actually been making some good headway working with our optometrist friends at the CAO, the Canadian Association of Optometry. They actually have a new CEO and executive director as well. He and I started within a couple of months of each other. And so we used that as an opportunity to start to forge some alliances and to start concentrating on some of the issues that we can agree on. There's obviously lots of areas where ophthalmology and optometry won't agree, particularly related to practice scope creep. But there are lots of things that we can do together. And so we've been starting to forge those alliances and partnerships on a number of initiatives. So we meet with them regularly, as well as some of the initiatives are related to advocacy. I believe I mentioned earlier, the advocating towards the government for a vision health desk within Health Canada. This is one of their priorities as well. And so we're working with them on that, as well as some of the other stakeholders in the eye care space, such as Fighting Blindness Canada, et cetera. We're also them on addressing some of the drug shortages. We did that quite successfully back in the summer. And then for the See the Possibilities website, we are working with them on the creation of a couple of videos. There's one that describes the difference between the 3 O's, and they're having some input on that, as well as a video related to glaucoma. The video will follow a patient through the glaucoma care space. And that's another initiative that we're working with the Optometry Association.
One of the challenges that we have faced or we've heard about from the planning committee for the conference is exactly as Guillermo has just mentioned, not only to keep our friends in industry involved and engaged, but also the participants. So I guess that would be I would assume, one of the top challenges coming up for our second virtual COS meeting. But what are some of the other challenges that you foresee in 2021 for the Canadian Ophthalmological Society?
So yes, for sure. That sense of engagement is one of the big challenges, as is Zoom fatigue. I mean, we all know it. We've all felt it. And so it's trying to create opportunities for engagement that try to, get beyond just another Zoom meeting or another Zoom presentation. So that's definitely one of the challenges. And from an internal perspective, from a manager's perspective, it's how do you keep that sense of team going and the spirits up as people all just get really tired. I mean, I think there are lots of advantages of working from home, and you don't have a commute anymore and worry about whether we're having a snowstorm or an ice storm. But at the same time, it's hard to stay motivated and engaged and productive day after day when you're working by yourself in your office. And then, helping to try to maintain that sense of community amongst ophthalmologists, I think is a big challenge. I know the Path to a New Vision webinar series that the COS hosted under the leadership of Dr. Roche and Dr. Mann early in the pandemic were really helpful to help create that sense of community across the country. And so how do we build on that and continue to maintain that level of engagement? then finances are a big challenge as well. We mentioned the pain that our partners and supporters are feeling. And so that translates into a lesser ability to support the COS. And so the COS is in good financial condition, thanks to the previous 10 years of financial constraints that were taken by the board and the previous CEO. So we have made the decision to keep moving forward and to try to support our members as much as we can, even during difficult financial times. Colin, I don't know if you wanted to add to that.
Yeah, I think you've alluded to most of the points. I think the challenge, I don't know, Cedere and Guillermo, I suspect you're finding the same thing. I'm relatively privileged here in Atlantic Canada, and yet I'm feeling fatigued by this pandemic and all that we're going through. And here, I'm not feeling the brunt of it the same way that other members are in other parts of the country. And I think the challenge is that not only that individual members face, but collectively, and the COS is its members, that we are us. I think the challenge is that as we move into 2021 and the promise of vaccines and so on, we sort of somewhere in our heads think of this as nearly over. And I think that's the key, is that it's not. And so from a COS point of view, I think what we have to do is continue supporting our members in every way we can. We did so in a variety of different ways that we've already alluded to at the beginning of the pandemic. But and Liz, I think you said it very well. One of the things that I found personally most useful in the early stages was during that Path to New Vision webinar, where we checked in with people across the country and just heard how our members were faring and got great ideas for how we could deal with some of the challenges we were facing. And I think we need to think about how we can do that as well and get a two-way conversation going and continuing in a similar way that webinar series. So I think that's probably going to be the biggest challenge, is finding ways to continue to respond to the membership and support the membership as we move forward. It's the pandemic is challenging and it isn't over. And the promise of vaccine is and the coming of vaccines is fantastic, and we're all looking forward to that. But there's some time to go before that's there, and we can get back to some other way of doing things.
Yeah, we still have a ways to go. And Colin, we often talk about the presence of the COS with the public as well, and obviously our responsibility as ophthalmologists with the public. Have you seen a shift? I remember in the past, we always used to get a lot of questions from the public and situations. Has there been a shift to that? Is there a new platform that has been created for patient engagement or people engagement from the public? How has that changed, or how is it moving forward with some of the new initiatives?
Yeah, it's a great question. I think there's certainly heightened senses of anxiety around healthcare in many areas, and eye care is no exception. We've had challenges to access during times where the pandemic is particularly active, and people are worried about their eye health the way they are other aspects of their health. And I think that produces more questions. And I think, a lot of our members individually have made efforts to be able to be accessible to answering those concerns and those questions through telemedicine and through other ways of having contact with their patients. And I think we've made efforts to try and get out there in front of the public and make them aware of the importance of continuing to access and pay attention to their eye health and not just put it on a back burner, because of course, eye disease doesn't wait because there's something else going on. And so I and other members of the COS volunteer group and leadership have been getting out in front of the public, doing public spots to remind them of the importance. We're in a time at the moment where we're talking about glaucoma awareness. Last month we were talking about diabetes. And so I think that's really important. I think the number of questions coming in because of that to the COS offices has increased, and Liz mentioned that to me the other day. So I think making sure that the public is aware of the importance of continuing to access their eye health care and getting the message out about the reasons for why that's important continue to be important, but perhaps again one of those things that's magnified by the pandemic.
As we've been going through this very confusing year, Colin and Liz, what have you guys been hearing from members? Have you noticed a shift in the types of communications and questions and queries that you're getting from membership to the COS?
An interesting question, and I'm trying to ponder it, and I'm not sure I've been in the saddle long enough to be able to do a great comparison for what the kind of questions we got before the pandemic and now. And I would say probably not. I mean, patient care is front and center, and early on in the pandemic, Colin mentioned a bunch of guidelines that were created on how to provide care safely. So we got a lot of questions about that, but otherwise, I don't see. I haven't seen a lot of changes in the questions that we've received. How about you, Colin?
Well, I think from my end, I think the concern would be that it's more difficult to have that casual two-way communication. You know, we all miss that, right? We miss it at our annual meeting. We miss it at our regional meetings. To some degree, you know, I'm a community ophthalmologist where there's only two of us in my area. But for those of you in larger centers or academic centers, you know, even those hallway conversations aren't as easy as they used to be because we're all wearing PPE and we're not casually sitting down in the lounge or the doctor's lounge. And so, you know, I think that's part of why I alluded to, I think as the COS, one of our things is going to be that we need to find ways to have that two-way conversation. And we can try and replicate some of that virtually. It's not as good as being at the annual meeting and sitting down for a coffee with our colleagues who we might not see otherwise, and having a great exchange of information. I think in a different world, Liz would have had her introduction to her first annual meeting by walking through the exhibit hall and walking through the plenary spaces and having casual conversations and being introduced to a lot of the ophthalmologists across the country. And that's one of the limitations of the digital world that we find ourselves in, is that unless you book a Zoom meeting, et cetera, I'm not likely to chat to you. Otherwise, you know, you and I and Guillermo might have sat down for a coffee at the annual meeting or a regional meeting or some other opportunity. So I think we have to find ways to replicate that. And I think we run the risk, if we don't do that, of not hearing those things from our membership and the questions and the concerns, because everyone's got their head down and working pretty hard at what they're doing in their practices at the moment. And so we need to find ways to invite that type of dialogue.
It seems to me, by listening to you both, Colin and Liz, that you really have captured a lot of the concerns, a lot of the challenges that are going through. And I think on behalf, I used to be a board member, but now I'm kind of a member of the community. And I am proud of what the COS has done. And I really, on behalf of those who are sort of out in the trenches, I would like to thank you both and the board for what the COS has done. I have really seen a great presence on it and a lot of good initiatives as well.
Thank you, Guillermo. It's kind words. Coming from someone who's and has been an integral part of that team at times, you know as well as I do that it's a team sport. The COS staff are amazing at what they do, and the volunteer base across all the aspects of the COS are amazing in the efforts that go into serving the membership. And while we're on that topic, I wanted to take an opportunity to give a little shout out to the initiative that you and Guillermo, and along with Eric and Liz have done to start this podcast, because this is also a brand new initiative that popped up during the pandemic. Not easy to get new things started, but this has been wonderful as well. So good shout out to you as well in enhancing the communication.
Yeah, I just wanted to echo what Colin said. Thank you, Guillermo. Those are very kind words, and definitely a team effort. And I'm very grateful to the members of the board, because they are kind and smart and thoughtful and overall enormously supportive of the team. And it really makes it very motivating and makes it easy for the team to do the job when they've got such a great group of people to report to.
Thank you to our guests, Dr. Colin Mann and Elisabeth Fowler, for joining us. We are looking forward to bringing you more episodes. Here's what's coming up on our next episode.
Hi, I'm Dr. Stephanie Baxter. I'm a cornea specialist at Queen's University. and I've been involved with the implementation of CBME, or competency-based medical education, at Queen's University. Changed PGY years, those will still exist in terms of each resident as a year 1 or year 2 or year 3, but each resident will progress through a stage of training. So when you first get to residency, it's called transition to discipline. So you're kind of getting to becoming a resident, and so it's the first month or two of a crash course of what it's like to transition from medical school to resident.
EyeCan wants to know what you think. Please send your comments on today's episode or any suggestions you may have for topics or features to communications@cos-sco.ca, and we'll try to incorporate them into future episodes.
The EyeCan podcast is funded by MDF Affinity Grant. It is brought to you by the Canadian Ophthalmological Society, directed by Eric Johnson, and produced by John Allaire from Allaire Strategic Works.